Hello and welcome to this episode of Focus On with me, Kamkhatsa Masipile. Today's episode highlights the Africa Health Exhibition 2024, which was hosted in Cape Town, where a number of policymakers and industry leaders gather to address some of Africa's pressing health issues. Today, we spoke to a number of experts on some of the innovations and solutions made available to advance the continent's healthcare system for the better. Thank you so much for joining us and thank you for your time. Now, we've gathered here at one of Africa's largest healthcare conferences. I want to zero in on your company, Beckman Coulter Diagnostics. One, give us a brief overview on some of the core functions of the company, but additionally, your role in the region's laboratory industry.
Thank you very much for the question, Kiamo. We're very excited to be here at Africa Health this year. And Beckman Coulter Diagnostics is renowned as a company that specializes in developing and manufacturing cutting-edge diagnostic laboratory technologies. And we provide a wide range of laboratory analyzers and assays that enable the healthcare professionals to diagnose disease quickly and to monitor patient healthcare. And we at Beckman are committed to relentlessly reimagine healthcare, one diagnosis at a time. And we're adamant that we will offer the best services to the wide high growth market that we have, which includes Africa as well.
I also just want to touch on today's conference. What is the importance of conferences like this in terms of highlighting some of the key functions of your company and as well as spreading awareness about some of the things you offer?
Thank you. So conferences like these are gold, because it enables Beckman Coulter Diagnostics as a cutting-edge diagnostic solutions company to be able to have events like this to showcase not only the new technologies that we've developed, but all of our products and ranges and our services that we provide, and enables us to touch the audience of healthcare professionals and industry experts in Africa and the EMEA region.
You've touched on cutting-edge technologies and your commitment to quality healthcare. I just want you to give us a brief overview or some insight into some of the newest innovations that Beckman Coulter offers.
I would love to do that, Kiamo, because that's why we're here. We have multiple instruments that are on our stand today. One of them is specifically what's called our DXC 500AU. It is a low-volume chemistry analyzer and has an intuitive interface that is designed to optimize the lab operations. It delivers the needed efficiency and provides trusted results. And this is critically important for laboratories and for pathologists and the results that they need to deliver. In a nutshell, the DXC 500AU is easy to use, it optimizes their operations, and it predicts their productivity and gives them trusted results.
Now, you've touched briefly on some of the innovations made available to healthcare practitioners, but another side of care is how you help the everyday individual. I just want to talk to you about how Beckman Coulter is giving back to the community outside of IVD solutions.
Beckman Coulter is actually part of a larger corporation called Danaher, and we are committed to minimizing our environmental impact. And we have set ourselves ambitious goals to achieve sustainable practices, such as energy efficiency, by ensuring that we reduce energy consumption across our facilities and implement energy efficient technologies. We also focus in on waste reduction and recycling programs across our facilities. In addition to that, we use sustainable packaging.
And just before I let you go, I just want to talk about improving efficiencies. Laboratories often face increasing pressure to not only innovate, but as well as innovate and improve their efficiencies. I want to talk about how the private sector, but more particularly Beckman Coulter, is working towards fostering or fortifying its role to support laboratories to improve their efficiencies.
This is such an important question these days because efficiency is spoken about by everybody. In the laboratory sector, there's several areas that are expected to evolve in the coming years to improve efficiencies. This is driven by advancements in technology, being automation and robotics and AI. And with Beckman Coulter, future technologies are focusing on helping the healthcare providers to diagnose diseases with unprecedented speed and precision. We also do this through workflow analysis, where we assess the workflow in the laboratory environment and bring efficiencies and also minimize the footprint of the analyzers in the laboratory. From the digitalization and data perspective, this is critically important in a changing world where data is so important. We are enhancing our laboratory information management systems and data management solutions to help laboratories to effectively handle and analyze large amounts of data, improve data integrity, and enable seamless integration with other laboratory systems. And this is where we are at the cutting edge of technology. And our stand, we have an AI technology machine around hematology. Very happy to share that with anybody who's willing to pop by. Thank you.
So thank you so much for your time. We've gathered here at Africa Health, one of Africa's largest health conferences. I just want to zero in on the significance of this year's conference being held in the Western Cape. What does that mean for your government?
So this is really an important conference for us in the province, and we're really pleased and in fact honored that the conference is in Cape Town in the Western Cape this year. The Western Cape is well renowned for some of our leading academics. We really have extremely competent academics. We have 4 academic institutions, so the academic component of the conference has in fact been excellent. We've had a number of plenary sessions and side plenary sessions as well, where we've had conversations with some of the leading authorities around the world about some of how people are struggling and grappling with health service delivery in other countries as well. Secondly, I think it's quite important that for the Western Cape, the investment opportunity that the conference represents and that in fact that the conference brings is enormous. And we really do have a government in the Western Cape that in fact encourages that strengthening of that relationship with the private sector. And in the health sector, we've really been working very well and very closely with our private sector colleagues.
Still staying on the conference, I understand today we'll explore a lot of topical changes or overhaul changes that the healthcare sector is faced with in South Africa, namely South Africa's national health insurance. I just want your take on this and some of the key discussions that you think will arise from this gathering today.
So this has emerged. Obviously, this is quite important for South Africa at the moment, with the NHI Act now having been signed into law by the President. And so it's useful for us to have conversations with countries who are grappling with very, very similar issues around how to balance their health service delivery needs with obviously the financial mechanisms and means to be able to deliver services to people. So it's really, it was really encouraging to have these conversations and understand that many countries around the world, both first world as well as third world countries, are in fact grappling with this issue at the moment of balancing health service delivery needs with financing mechanisms. So those are some of the issues that have emerged during the course of the day and will obviously continue emerging. We've had conversations also about some of the health outcomes. How do we improve health outcomes for the population? So, for example, issues around women and maternal health featured quite strongly in a couple of the plenary sessions. There are obviously issues around child health and child nutrition. Those feature quite strongly. But also in the Western Cape, we actually have a very strong burden of disease, particularly in HIV and TB. The Western Cape has some of the highest incidence of TB rates in the world. And so we've been able to impart and share some of the lessons that we've had in strengthening our TB programs, our HIV programs, for example, with people from other countries who've in fact learned from how we've been doing things as well. We also have quite a strong focus on technology and information technology in particular, and how we utilize information to be able to strengthen the health service delivery platform in the province. And along with that goes a number of innovations that we've implemented in the Western Cape, and we were able to share those lessons with colleagues from other countries, as well as learn from them as well how they've used health technology to in fact improve health service delivery.
I want to go back to your earlier mention of some of the work government is doing with partnering with the private sector, but additionally as well attracting investment. Within your portfolio in government, what are some of the initiatives in place to increase health outcomes in the province, but as well as increase investor confidence into the Western Cape government?
So in the health sector in the Western Cape, we really have very, very strong relationships with our private sector colleagues. We believe that we are all part of one single health system. And because we have the responsibility as the public sector for the health stewardship of people in the province, we work very closely with our colleagues in the private sector and a range of private providers, people involved, for example, in the private hospital industry, private medical practitioners, private allied health practitioners. We also work with the private laboratories, with private pharmacies. So we really have very strong relationships with the private sector in the province. We spent many years building up those relationships. So we have a relationship of trust. And because we have the stewardship responsibility for health in general, our colleagues in the private sector trust us to be able to ensure at least that we are able to bring the public and private sectors together to ensure that we improve health outcomes in the province. We have a number of engagements, formal engagements with our private sector colleagues. We are looking at how we share data with each other. We are looking at the accreditation processes for private facilities in the province. We're looking at a range of service benefits packages and how we can in fact leverage off each other in trying to improve our health outcomes in the province.
And lastly, just before I let you go, one of the key aims of conferences like this is often to look into the future of healthcare. I just want, from your opinion, what is the outlook for South Africa's healthcare sector?
I think South Africa's healthcare sector generally has a number of challenges at the moment. I mean, we know about those challenges. We're fortunate in the Western Cape in that our health system in the province really is very strong. We have challenges, as many other countries in the world have challenges in the health sector, but we really do have a very strong health system in the Western Cape. And so we are obviously using the opportunity to learn from these other countries of how they improve health services in their respective countries. So I think for the future for South Africa, conferences like this can only bode well if we share lessons across countries, if we share lessons between the North and the South and the East and the West of how ultimately we all are trying to achieve the same objectives. In other words, we are needing to ensure that we achieve health outcomes that can improve the lives of people in whichever countries they live in.
And that's how we wrap up this episode of Focus On at the Africa Health Exhibition 2024, hosted at the Cape Town International Convention Centre. From me and the CNBC Africa team, it's goodbye for now.